Hi students, how are you? Did you do well with your midterm exam? I hope you all got high scores. For this video, we are going to push through with our previous topic, which is the digestive system. Now to continue, we are going to learn about caring for the digestive system, the different digestive system diseases, and the ways that we should do to prevent them. We said that the digestive system is made up of many organs that work together. Starting from the mouth, we chew and break food into little pieces and send it down the esophagus into the stomach. In the stomach, food is digested and sent into the small intestine, where nutrients enter the blood. Any undigested food will enter the large intestine, where it leaves the body as feces through the anus. So again, these are the parts of the digestive system. Let's repeat. We have the mouth, esophagus, the stomach, small intestine, the large intestine, and finally, the anus. The digestive system has many organs working together to break down food and take up nutrients into the body. We should care for our digestive system to make it work well and avoid diseases. So, here are the examples of digestive system diseases. We have gastritis. We also have irritable bowel syndrome or the IBS. Irritable bowel syndrome or IBS. We also have gastroesophageal reflux disease. Gastroesophageal reflux disease or known as GERD. We also have diarrhea. We have pancreatitis, and also cholecystitis. Now, we are going to learn about these diseases one by one by watching videos. So let's start with gastritis.
A healthy digestive system requires a fine balance of bacteria in the gut. Gastritis is an inflammation of the stomach lining. This happens when the balance is affected by the overuse of pain medications, alcohol, or an underlying condition. Symptoms include upper abdomen pain, nausea, vomiting, and a reduced appetite. No wonder you don't feel like playing golf. Often, gastritis is linked to a bacteria called Helicobacter pylori. Over 30% of all people have this bacteria in their stomachs. Left unchecked, it can cause a weakening of the protective mucus that lines the stomach. When this happens, the stomach wall becomes inflamed from stomach acids. Gastritis is more common in older adults who have thinner stomach linings. They've also had a lifetime to accumulate the bacteria. Correct treatment is important. Long-term gastritis can increase the risk of an ulcer or cancer. Treatment may include antibiotics to help restore the balance of bacteria. The condition is not normally dangerous, and with correct treatment, you'll get back into the swing of things in no time.
That's it. We also have irritable bowel syndrome or IBS.
Irritable bowel syndrome or IBS is a mix of intestinal symptoms which may include discomfort, bloating, pain, diarrhea, constipation, etc. The exact causes of IBS are unknown, but experts believe that a combination of the following factors leads to IBS. Firstly, poorly coordinated nerve signals between our brain and gut cause abnormal contractions in the muscles of our intestines. If the abnormal contractions are too fast, the food moves faster, making it difficult for our intestines to absorb excess water, thus causing diarrhea. Whereas, if they are too slow, the food moves very slowly, causing constipation. Secondly, hypersensitivity to certain food or pain may contribute to IBS. Thirdly, bacterial infection may lead to loss of useful bacteria in our intestines, thus triggering IBS. Lastly, experts believe that hormones may also have a role to play because IBS is more common in females than males.
Okay, we also have gastroesophageal reflux disease or GERD.
Gastroesophageal reflux disease, also known as GERD or acid reflux, is a chronic condition in which stomach contents rise and enter the esophagus. This occurs due to problems with closure of the lower esophageal sphincter, or LES, which is the junction between the stomach and esophagus. The most common symptoms are a burning sensation in the chest called heartburn, regurgitation, and an acidic taste in the back of the mouth. Heartburn typically occurs after eating and may worsen at night. Less commonly, people may experience dysphagia, or difficulty swallowing. Dysphagia can manifest as pain when swallowing, a sore throat, choking, coughing, gurgling or regurgitating food or stomach acids, feeling that food is stuck behind your breastbone, a burning sensation behind your breastbone, and hoarseness. There may also be nausea, frequent burping, chest pain, the sensation of a lump in your throat, wearing away of teeth, and bad breath. GERD can cause a recurrent cough, breathing difficulties, chest congestion, and lung inflammation leading to asthma, bronchitis, and pneumonia.
Okay, we also have diarrhea.
What causes diarrhea? Intense love for restrooms. Diarrhea is a condition in which we frequently pass loose, watery stools. Let's see some causes of diarrhea. Firstly, during digestion, bile acid produced by the liver is absorbed by the small intestine. However, in a condition called bile acid malabsorption, the bile is not absorbed. Hence, the bile enters the large intestine and begins to irritate its lining. This stimulates the release of water and salts, thus producing watery stool. Secondly, the function of our large intestine is to contract and push the undigested food and absorb excess water. However, in a disorder called irritable bowel syndrome, the large intestine doesn't contract normally. It pushes the food too fast, affecting the absorption of water, thus leading to diarrhea. Lastly, a harmful parasite called Giardia also interrupts the process of absorption of water in our intestines, causing diarrhea.
We also have pancreatitis.
Chronic pancreatitis is caused by long-term inflammation of the pancreas, which eventually leads to the irreversible destruction of pancreatic tissue. Chronic pancreatitis develops slowly over time and is predominantly triggered by lifestyle factors in predisposed patients, such as long-standing heavy alcohol or tobacco use, although this is not always the case. Other less common causes are medications that put stress on the pancreas, elevated triglycerides, some autoimmune conditions, and some inherited or genetic conditions, notably cystic fibrosis and hereditary pancreatitis. In some people, the cause of chronic pancreatitis is never discovered and remains a mystery.
Okay, we also have cholecystitis.
Cholecystitis. Cholecystitis is an inflammation of the gallbladder. The gallbladder is a 4-inch pear-shaped organ on the right side of the abdomen, beneath the liver. The gallbladder stores bile made by the liver. Bile is a combination of fluids, fat, and cholesterol. The gallbladder travels through the cystic duct and delivers bile into the small intestine via the common bile duct. The bile helps to break down food in the intestine, allowing for easy absorption of fat-soluble vitamins and nutrients into the bloodstream. The common bile duct connects the liver, gallbladder, and the pancreas to the small intestine. Cholecystitis can be acute or chronic. It can become chronic if it persists for a prolonged period of time, or if there are recurring symptoms from the inflammation present. If left untreated, cholecystitis can lead to serious, life-threatening complications, such as gallbladder rupture, tissue death, or infection within the gallbladder.
So, these are the different digestive system diseases. We keep our digestive system healthy by doing the following. First, eating clean and freshly cooked food. Second, eating foods high in fiber, for example, vegetables and fruits. Eating on time and eating 3 meals each day. avoiding foods that are too sweet, too salty, or too sour. Exercising regularly, not smoking or drinking alcohol, and drinking at least 6 to 8 glasses of water or enough water to feed the body daily. So these are the ways that we need to do to prevent these digestive diseases. Now, for our activities, you can open your book to page 59. Now here, again, we are going to name or label the different parts of the digestive system. So, this part again is called, it's called mouth. What about this tube? This is called esophagus. That is right. What about this pear shape? This is called stomach. After the stomach, we have, this one is called small intestine, and we have the large intestine. We also have two questions here that we need to answer. For number 1, it says, which organ breaks down carbohydrates? Which organ breaks down carbohydrates? Is it the mouth, esophagus, stomach, small intestine, or large intestine? If you said it's mouth, then you're correct. Number 2, which organ breaks down pork? Which organ breaks down pork? What nutrients can we get from pork? It's protein, right? So, again, which organ breaks down protein? Is it mouth, esophagus, stomach, small intestine, or large intestine? If you said the stomach, then you're correct. Now let's move on to page 61. On page 51, it says here, read the text and answer the questions. So let's read all together. Let's start. Gastritis is an illness in which the stomach walls become swollen and painful. It happens when the stomach gives out too much acid for digestion, making some of it to break the walls of the stomach. It also happens because of stress, eating unclean food, not eating on time, and eating strong food. Now, so we have here two questions. Let's read number 1. What causes gastritis? What causes gastritis? From this passage, what causes gastritis? You can write your answer. That's right. It is caused when too much acid is given out and some of it breaks the wall of the stomach. This is just my answer, but you can write your own answer. For number 2, how can we prevent gastritis? How can we prevent You can also write your answer. Okay, so we should eat on time, eat clean and freshly cooked food, and avoid strong food. You can also write your answer. Now, for your homework, you can open your book to page 51. So again, just like what we did last time, you are going to write the different organs here of the digestive system and their functions. I repeat, write the organs and their functions. Then after that, sum it up. So that's it for today. Have a great day and goodbye.